The staff at People's Community Clinic and specifically Center for Women's Health all have an amazing heart and spirit. People's Community Clinic is very innovative and collaborative. I truly think that that is what has kept it going and making it a forefront for the future of healthcare.
Our team consists of 6 OBGYNs, 5 mid-level providers, a mixture of nurse practitioners with women's health or family practice background, as well as a certified nurse midwife.
Here in People's, the patients get continuity of care. So from day one that they find out that they're pregnant, we say, come on in, we'll get a pregnancy test done, we'll do ultrasounds, we'll do full physical exams, we'll see you every X amount of weeks until you deliver. And the beauty of People's is that we give our patients the opportunity to deliver with us.
We've been able to expand the services we provide for women's health from just being primarily contraception and OB care to focusing more on gen specialty level services. We've also been able to provide gynecological surgeries at a surgical center here in town called Bailey Square. We're also able to treat patients who are diagnosed with a miscarriage more comprehensively. Now we're able to dispense medication that can help treat the miscarriage here in office, and we can also provide surgical management of that condition. So in the future, when we expand and move across the street over to St. David's, the Center for Women's Health is going to be able to, first of all, have more exam rooms. So we're going to be seeing more patients. We're going to be staffing more clinics. So it's going to be a general expansion that will increase our ability to provide valuable women's healthcare services for our community.
So there's a saying, which is that your zip code is more important than your genetic code. And that's because the spaces in which we live, grow, work, play, worship, and age have dramatic impact on our health. These are called social determinants of health, and medical legal partnership means that you have an expert in those spaces who's a member of the care team. What has that meant at People's Community Clinic at the Center for Women's Health? Well, it has meant that a pregnant person who needs accommodations at work has a professional employment attorney and an advocate who can help with those accommodations.
I think what I find most rewarding about being an OB is being able to walk with patients during some very vulnerable but also exciting times in their lives. I also think it's a privilege to be able to walk with patients when they're in a really difficult point in their life, be it mental health issues, be it social stressors, be it social determinants of health, and seeing the resilience that our patients have. It's very inspiring.
When I first met Whitney, she was pregnant and was having a lot of difficulties with her social circumstance. She has been able, with all of the variety of programs we have, to transform her entire life to one of stability and happiness. She is currently pregnant, and we are having a very routine, normal pregnancy. So I'm very happy for her. She's one of the great success stories. She's quite a jewel to me.
We ended up pregnant, and I came here to the clinic and I met Dr. Pearce. He was so nice. He's just a very sweet, gentle doctor, and it's hard to find a good doctor that you can talk to whom understands you and don't judge your past. To know him is to love him, literally.
It's been said that philanthropy steps in where government falls short. That means that donors matter. It is the work of donors that enabled us to bring an attorney on site to work with patients to resolve their health-harming legal needs. It means that donors matter for other wraparound services, for ancillary care that is instrumental to achieving health, both for individual patients, but also for whole communities.
SB 8 rocked our world at CWH. There were a lot of things that needed to change. Prior to SB 8, we were able to let patients know if they called our call center and were seeking out abortion care, that no, this isn't a location where you can get that, but here are resources. We were able to help the community with resources. People's Community Clinic consulted with lawyers to make sure that everybody was safe and protected and had the right knowledge of what you can and can't say. That was critical to us moving forward and still being able to supply what we could to our patients in their time of struggle within this ruling.
One of my favorite things about being an OBGYN is the conversations I'm able to have in the patient room. I'm being afforded the opportunity, I'm being let into a patient's life, into a very intimate space. And I think that room creates a safety net for that patient because it is such an intimate space. And we recognize as OBGYNs the sacredness of that space. And the minute that someone starts intervening, it starts to eat away at how sacred that space can become and how safe it can be for a patient.
The things that we do here change generations.
You have a lot of women that want to give up, and when they have good doctors and a good clinic to go to, a very supportive clinic, and just care about them for who they are and help them, and it's an amazing, amazing feeling.